And in our top business story, the International Monetary Fund has predicted a 2.3% fiscal deficit for the UAE this year, much lower than what many private sector forecasters had been expecting. A shortfall in the government's budget, its first since 2009, has been widely expected since oil prices slumped at the end of last year. Global oil prices averaged about $100 a barrel last year, but this year they have been averaging about $60 a barrel. The IMF will release a full report on the UAE's economy next month and is forecasting a consolidated fiscal deficit of 2.3% of the UAE's GDP this year, compared to a 5% surplus last year. Additionally, they are expecting inflation to rise this year because of higher rents, despite the easing home prices in Dubai. The UAE's non-oil economy is also expected to grow 3.4%, while inflation would increase 3.8% this year. The IMF expects overall economic growth of 3% this year, down from 4.6% last year, but the fund praised the government's policies and continued spending on major infrastructure projects for blunting the impact of lower oil prices on economic growth. Real estate research firm FIDA Advisory has released its Q2 mid-quarter Dubai residential research note that shows that residential prices have continued to decline in the first 6 weeks of Q2 compared to the first quarter of the year. The reports showed that apartment lease rates decreased a nominal 2.4%, while sale prices decreased 1.5%, marginally tightening yields. Lease rates for single-family homes decreased 0.6% and sale prices decreased 2.9%, which pushed up yields slightly. According to Jesse Downs, the managing director of FIDA Advisory, the ongoing erosion of sale prices is a healthy correction, adding that the more significant concern is the scale and nature of the upcoming launched and announced projects. In the first 5 months of 2015, apartment transaction volumes were down a modest 1.5% compared to the same period in 2014, and the volumes for villas contracted almost 25% over the same period, with the figures based on initial transactions data from the Dubai Land Department. The report also references income-specific supply-demand imbalances, where they believe that if under construction and launched projects are considered, overbuilding in the mid to high income segment will likely increase competition, which could be oversupplied by up to 40% in 5 years. Etihad Airways has reached a deal to deepen its relationship with Air France-KLM and separately has agreed to sell its stake in Aer Lingus Group. According to a local report, Etihad CEO James Hogan said that the airline and Air France-KLM will share codes on more flights starting this year, opening more European cities to the Abu Dhabi-based airline's customers. Hogan made the comments on the sidelines of the International Air Transport Association's annual meeting with the airlines, having yet to finalize the terms of the deal. Additionally, Etihad will sell its 4.99% stake in Aer Lingus, the Irish flag carrier, in a potential takeover bid by British Airways' parent International Airlines Group. The moves reflect Etihad's strategy to grow its route map through airline partnerships. With codeshares on French domestic flights imminent, Etihad also is looking to add destinations via codeshares with Philippine Airlines, Garuda Indonesia and Malaysia Airlines, according to James Hogan. Etihad currently lists its flight code on 9 Air France cities and 21 KLM destinations. Recent technological developments have led to a rapid digital transformation of healthcare, which has also created a demand for fast and efficient construction of hospitals. That's according to experts who are taking part in the Building Healthcare Middle East exhibition and Congress. His Excellency Humaid Al-Qattami, chairman of the board of Dubai Health Authority, officially opened the 7th edition of the show, where over 100 companies from 70 countries are exhibiting latest healthcare technology and innovative products. Running until the 10th of June, the 3-day trade event has attracted experts and leaders related to regional hospital construction, architecture and infrastructure development industry. Focusing on design, operations, patient care and investment, much of the focus throughout the event was on increased use of technology and its impact on patients as well as medical professionals. Running alongside the exhibition is the Congress, where medical professionals are leading discussions on the key trends affecting the quality and sustainability of healthcare. Leading the session titled Healthcare of the Future, Dr. Sapa Tanli has advocated for an increased use of smart wearable technology to improve employee engagement, together with encouraging a healthier lifestyle. Using telemonitoring and activity tracker such as Fitbit, Dr. Tanli believes that such technology can save time, reduce costs of hospital transactions and health insurance.
What it comes in equation is what's missing is how can we manage people's life choices for health and wellness, and how can we integrate all those existing and already established products, markets, and growing in interest from all those. So I think that what we're looking at now, taking a population, and it's an amazing way to also manage the population and population health. Then you kind of connect the clinicians, but also non-clinicians have an effect in your daily life. From different countries, a pharmacist to your home cook mom or your personal trainer. So how can we connect everyone using these technology and then support you when you are making active lifestyle choices or push you from that? The benefit of using such that preventing people going to the hospitals will affect the millions of dollars of costs. So there's certainly a cost benefit is there. And the more critical part is, I guess, changing people's behaviors.
With Dubai's ambitions of attracting 500,000 medical tourists a year by 2020, hospital construction industry is expected to flourish across the region. Kef Tapi was one of the exhibitors at the event, hoping to capitalize on the surge in demand by offering their assemble rather than build concept from their $350 million factory in Jebel Ali, which is slated to open in December this year. Reducing the time required to build a hospital to just 1 year, company officials believe that robotic construction technology will shape the future of the industry.
We will be building the hospital rooms, hotel rooms, bathrooms, kitchens, everything using robotics, and that is one of a kind in the world. 7 or 8 projects currently we are working on in this part of the world. The industry is very excited because normally a hospital takes 5 years design and build, and we are talking about 1 year, and also it brings down the finance costs, interest costs. So it's really going to be revolutionary.